This section of the video is for retirees that are not entitled to Medicare at the time of their retirement. If you will be entitled to Medicare at the time you retire, please watch the video entitled Medical Plans for Retirees Entitled to Medicare. As a retiree not yet entitled to Medicare, you have several plan options. The plans include Group Health Classic, Value, or the Consumer Directed Health Plan, or CDHP, Kaiser Classic, or CDHP, or Uniform Medical Plan Classic, or CDHP. Group Health and Kaiser do not have providers in every county in Washington. Check the PEBB website or the Retiree Enrollment Guide to see if the plan is available in your area. In most cases, you must live in the medical plan service area to join the plan. The map shows plan availability by county. The yellow and white striped areas show the counties and zip codes within a county where Group Health and Uniform Medical Plan are available. The blue and white striped areas show the counties and zip codes within a county where Kaiser and Uniform Medical Plan are available. UMP is available in all counties in Washington, represented on the map by the white areas. In addition, UMP has providers both nationwide and worldwide. Review the map to determine which plans are available in your area. In most cases, you must live in the plan area to enroll in the plan. Group Health, Kaiser, and UMP each offer 2 to 3 types of plans. The types of plans include Classic, Value, and the Consumer Directed Health Plan, or CDHP. If you choose one of the Classic plans from Group Health, Kaiser, or UMP, you can expect to pay a higher monthly premium, but you may pay less out of pocket when you require services. If you choose the Value plan from Group Health, the monthly premiums will be lower than the Classic plan, but you may pay more out of pocket than the Classic plan when you require services. If you choose a CDHP from Group Health, Kaiser, or UMP, you will pay a lower premium, but you will pay more out of pocket than the Classic or Value plan when you require services. The CDHP has 2 components: a high-deductible health plan and a health savings account, or HSA. The high-deductible health plan is exactly what it sounds like. You will pay more out of pocket before the plan will begin to pay. The HSA is a tax-exempt savings and spending account used to pay for qualified medical expenses that helps offset the higher out-of-pocket costs of the plan. Your HSA will be partially funded through the premium you pay each month. You also have the option to deposit money into the HSA through electronic bank transfers or by mailing a check to Health Equity. You may fund your HSA up to the annual maximum allowed by the IRS. The IRS has guidelines as to who is eligible for an HSA. You must be eligible for the HSA to enroll in the CDHP. Refer to the Retiree Enrollment Guide or the PEBB website for eligibility requirements, contribution amounts, and annual maximums. If you enroll in the CDHP as a single subscriber, which means no family members are on your account, each month the Healthcare Authority will deposit $58.34 of your premium payment into your HSA account for an annual total of $700.08. If you enroll yourself and at least one other family member on your account, each month the Healthcare Authority will deposit $116.67 of your premium payment into your HSA account for an annual total of $1,400.04. You have the option to deposit additional funds by sending the deposit directly to your HSA account. When making additional deposits to your HSA, be sure you do not exceed the annual maximum allowed by the IRS. For 2013, the IRS allows a single subscriber to deposit up to $3,250 for the year. For subscribers with at least one other person on their account, the IRS allows a maximum of $6,450 for the year. If you are age 55 or older, you may contribute an additional $1,000 for the year. So if you are a single subscriber, age 55 or older, you could deposit up to a maximum of $4,250 in 2013. Or if you are a subscriber with at least one other person enrolled on your account and you are age 55 or older, the maximum you could deposit is $7,450 for the year. When calculating the amount you would like to deposit for the year, remember to include the amount deposited on your behalf by Healthcare Authority. If your maximum for the year is $4,250, HCA will deposit $700.08 of that total. You would be able to deposit up to $3,549.92 for the year. In addition to setting the maximum contribution allowed, the IRS has rules around who may be enrolled in an HSA. To be enrolled in an HSA, you must be enrolled in a qualified high-deductible health plan. The CDHP plans offered by PEBB meet this requirement. You cannot be enrolled in other comprehensive health coverage that is not a high-deductible health plan. You cannot be enrolled in Medicare. You cannot be claimed as a tax dependent on someone else's tax return. You cannot have received care from the VA or one of their facilities, including prescription drugs, within the last 3 months. You cannot be enrolled in TRICARE. And if you have a VEBA account, you must make the VEBA account a limited purpose VEBA. In addition, if you choose the CDHP and have family members entitled to Medicare, you may not enroll your family members on your account. To include your family members entitled to Medicare on your account, you must choose one of the Classic or Value plans. If you and the family members you wish to enroll are not entitled to Medicare, you may choose one of the CDHP plans.